Hello, everyone. I'm Peter Luckman, and I really want to welcome you with a distinguished panel. I'm the International Society of Quality in Healthcare CEO, ISQA, based in Dublin, and our panels from all over the place. So that's the beauty of Zoom, that you can get people over. You can see them there. I have Judy Stenmark, Monica Lessel, and there's Pradeep from IOPO, and that's me over here as well. So we also have Needham Dhingra, who is from the World Health Organization and is in Geneva right now. And what she is doing is she will be joining us for a short audio call, because she's just about to open up the session that WHO are having on World Patient Safety Day. This is a very important day, and it's all about safety. And what I'm going to just show you is one slide that has just come out in a journal we just published, Paul Batalden, which showing the importance of patient safety and involving the person surrounding safety and quality and effectiveness all the time. And this means that we have to work in partnership with people. And you're going to hear about this today from our two speakers and from Needham as well. I'm not going to take up too much of your time, other than to say that we're going to have Q&As afterwards. So if you can put the questions, the Q&A questions in the box, where you can see at the bottom the Q&A questions. There's also a chat box that you can chat around with, so we can see it, and I'll be monitoring that. But we are going to go ahead with the two talks. We will have first Needham, and then we will have the two other speakers, each with 10 minutes. And then we'll have Q&A. So I'd really appreciate it if you put questions out for us to have at the end of the session. There's lots of time for questions. So I'm going to ask for the team to start off with Needham's presentation. This will be an audio presentation, as Needham is presenting right now in Geneva.
Greetings from the World Health Organization in Geneva, and congratulations on organizing this Global Patients Congress to coincide with the celebration of World Patient Safety Day. I'm truly honored to be invited to speak at this very important event. The International Alliance of Patients Organizations underlines the vision that patients are at the center of healthcare throughout the world. Patients and patient organizations play a vital role in holding the systems accountable and in making healthcare safer. World Patient Safety Day provides a torch-bearing platform which brings spotlight on global, national, and local patient safety issues. This year, the World Patient Safety Day shines a spotlight on health worker safety and its impact and interaction with patient safety. These indeed are two sides of the coin. Avoiding unsafe injections linked to avoiding needle-stick injuries. Adverse events relate to overwork, long hours, and burnout. Surgical errors relate to poor teamwork, inadequate communication, and clinical team hierarchy. The COVID-19 pandemic has caused enormous pressure on the ecosystems of health, society, and economy worldwide, and the fault lines in health systems have been exposed. The challenges which our health workers have been facing each and every day have now caught global attention, with catastrophic and avoidable loss of lives and harm during the pandemic. The global landscape of healthcare has been constantly changing, and the models of care are going to change now drastically in post-COVID era. For instance, while we increase health coverage and provide essential health services using telemedicine, the safety risks both to health workers and patients will also need to be addressed. Patients and caregivers are sometimes the only constant factor in healthcare. Empowered patients who also know their medication can play a pivotal role in ensuring patient safety, especially medication safety in transitions of care. There is a lot of untapped potential in patients. Now, when healthcare has moved to homes, this is a challenge that patients must resolve through the use of digital solutions and telemedicine, providing feedback is a very important way to make these services and systems work better and safer. Health system is currently not managed like other high-risk industries, and going forward, this will not be sustainable. It is vital to imbibe a safety culture in our day-to-day work like in these industries, and healthcare organizations need to transform and become highly reliable, resilient, and learning organizations. We need the strong political will to make this a reality. Patients and patient organizations can also play a pivotal role by engaging and advocating to policymakers. The role of patients' organizations in patient safety is very important in amplifying the voices of individual patients and providing patients' perspectives where policy matters and health leaders can consult in planning and decision making. In the ongoing pandemic, patients' organizations are well positioned to discuss with healthcare sector how to ensure safe delivery of essential health services. It is also a patient safety risk if people cannot access health services in a timely manner during the pandemic. WHO has recently opened a public consultation for Global Patient Safety Action Plan 2021 to 2030 towards zero patient harm in healthcare. Patients are an important stakeholder, and we encourage you to have a look at this action plan, as this is a unique opportunity to integrate patients' perspective into a high-level document. I believe investment in public education, health literacy, patient and family engagement and empowerment will be a key approach and will go a long way in making people more accountable for their own health. This year, on World Patient Safety Day, to ensure the safety of our patients, let us speak up for the safety and the best working conditions for our health workers as well. Mr. Kamaldeep Sahami told me that IOPO is encouraging patients to bake a carrot cake for their health workers, so don't hesitate to give one to your GP or simply thank the people who work in the clinic, the person taking blood samples or the person cleaning the clinical areas. Let us create a path for urgent and sustainable action globally with the vision that we can live in a world where no one is harmed in healthcare. Thank you very much for this opportunity.
Thank you to Needham, who is in Geneva, as you say now, on the call for us to think about the healthcare workers as well as the patients, because you cannot have patient safety if you have unsafe healthcare workers who feel either physically or psychologically unsafe. And we're going to hear more about this. The other thing that Neelam mentioned, so I'm going to tell you all, is the consultation that she's having. She's leading on for the WHO. It's out now, and in the chat box I'm going to put the link after I finish speaking, so that you can all, very important for patients and patient organizations to comment on the roadmap that they're developing for the decade of patient safety. So that's my finish of Needham. We'll have some questions later, and I'll try to answer for Needham. But now it's a great pleasure to call on Judy to speak. She's going to speak on self-care. Needham's already alluded to this, of the importance of self-care that patients had to take on the care for themselves in the last 6 to 8 months when they couldn't get to see their healthcare providers. Now self-care became even more popular and more able with telemedicine, digital health, etc. So now we're going to hear from Judy Reddy on how we can make self-care some more available and in a better way. So up to you, Judy.
Okay, thanks so much, Peter, and hello everyone. It's my pleasure to be here, and thanks Kamaldeep for asking me, and happy World Patient Safety Day to everyone. So I'm the Director General of the Global Self-Care Federation, and some of you may have known us as the World Self-Medication Industry, which we were up until last year when we changed a little bit of our focus, if you like, with the new strategic plan. But we represent associations and manufacturers in the self-care industry, and our commitment is to better health outcomes for all and sustainable growth as well. And our our work now with our members and with stakeholder groups in particular is about delivering better choice, better care, and better value to the patient and the individual. Okay, it works. All right, so we have been in official relations with WHO since 1979, in fact. So for a long time, trying to contribute to WHO's public health goals and through various expertise and various groups, in particular, looking at universal health coverage and promoting healthier populations. But in our current collaboration plan, we're working closely with WHO on the development of a self-care readiness index, which will be an important advocacy tool. So watch this space, and I'd like to thank IAPO, who've been really helpful in trying to get patients and consumers, if you like, to fill in our surveys, and also healthcare professionals. But we really believe that will be a significant tool going forward for us all. So I just want to remind everyone of WHO's definition on self-care, the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support of a healthcare provider. And that's the important thing. So it's about holistic activities and practices and products. It could be medicinal devices, different things that someone can adopt to improve their health and well-being. So there's a lot of different, there are a million variations on what people think is self-care. So getting a massage is fantastic and that's great, but we wouldn't necessarily say that's self-care as such, but particularly about making healthy lifestyle choices, avoiding unhealthy habits like smoking, of course, and making responsible use of prescription and non-prescription medicines such as OTCs, and that's part of the Global Self-Care Federation industry members. Recognizing symptoms, monitoring symptoms, and self-management. So really it's about being an active self-manager of your illness or disease or health problem. So we really believe self-care benefits everyone. It benefits the patient, the individual, and systems. So for individuals and patients, it gives better choice and more options. And of course, better value as well, because it's not about always having a prescription medicine, although of course that's important with various diseases, but it can lead to better long-term healthcare outcomes when people become active self-managers of their health and use the health system appropriately and when they need to. But we saw it during the pandemic, of course, with COVID. I mean, the NHS in the UK is a particular example where people stayed away from emergency services where they might have gone to because they had their arthritic hips were bad, or they had the flu, not COVID. And so we saw that people stayed away. Some people might have stayed away too much, in fact, but they utilized the community pharmacist and community nurses. And we really believe pharmacists came into their own during the pandemic, because a lot of people who hadn't realized before realized, hey, the pharmacist is a fabulous source of information and can give great advice, and also is there if you needed your OTCs like paracetamol and anti-inflammatories. So it eases the burden, and that means it saves money as well, money and time, and that's what's all important. And at the moment we're engaging in a big economic study, if you like, in tandem with our self-care readiness index to really try and get a handle on how much do we save by engaging in self-care. So this is an example of one of our cards we used during the height of COVID, if you like, in Europe, and we partnered with IAPO and FIP, the pharmacists, to really try and get the messages out about you're staying at home. Okay, you need to be safe, and you need to use OTCs perhaps responsibly. Things like anti-inflammatories and of course paracetamol, which were really two very important OTCs, which were used during and still used to manage the symptoms. So, but we all know there was also a big infodemic during COVID, and that continues, and a lot of misinformation as well. So we want to give people better access to information. We want people to be more health literate, and that should be a priority. But we need to make sure that people are accessing the right information, accurate information, science-based information, so that patients can reduce, we can reduce confusion for patients and individuals. And of course, relying on sources like WHO for information, always linking to that, etc., can help with the fear mongering. So this is just one of our social media cards we used as well during the pandemic. And as I said before, the pharmacists really came into their own, and we have very good relationship with FIP, but really in terms of self-care, we really think the pharmacist is pivotal in that whole continuum of offering advice, very good advice, and pointing people in the right direction if they need to talk to other people or have more referrals. So what else did we see during the pandemic? That digital health data, the way we used digital services changed remarkably, and often for the better. We saw drive-through services, telemedicine, medication deliveries, and of course, again, example of the NHS, that people some people may not need to visit a GP very much in the future, if for certain conditions. So I think that was one of the big things that we saw during it. And so knowledge transfer for better global health. Again, I just wanted to focus on digital healthcare and telemedicine. We need to keep patients informed and empowered, but getting the right medicine and the right information, if you like. And this space is just going to, it exploded this year, and it's just going to continue to explode as well. So now is the time for self-care. COVID-19 has put self-care under the spotlight, and in a funny way, I guess it was an opportunity for us to get more of our messages out, partner with others as well that we mightn't have partnered with before, to really show that engaging in self-care can lead to better health outcomes. I talked about the pharmacist, but we also saw that certain regulatory flexibilities occurred in terms of getting certain medications through and keeping supply chains open, which we really hope will continue post-COVID. So the private sector as a force for good, and just leading into the next presentation of Monica, that our industry, the consumer health side, non-prescription side, we saw our industry really band together to support whoever needed help, whether that was through money, whether that was through research, and of course, in terms of a vaccine, but helping people with suppliers, working closely with governments, with patient organizations. And so I really think everyone came into their own as well during this, and it was really fantastic to see. So self-care has never been more important, with people taking control of their own health, also beyond the pandemic. So we're really excited about the future, and we look forward to working with all of you for better choice, better value, but of course, better health outcomes. So thank you, Peter. Back to you. You're on mute.
Yeah, I'm off now. Yeah, thanks a lot, Judy. That was great. Just letting us into the importance of self-care. We're going to have a few questions later, and I'm going to go straight to Monica from Bayer, who's going to talk about the work they did during the pandemic and the work we can do further. And this appeal to all of you. If you want to have questions, now's the time to put them fresh in your mind for Judy. Put them into the question box so you have them there, and you'll hear Monica. Thanks a lot. Off you go, Monica.
Yeah, thanks a lot, Peter. And it's great to be here on this Global Patient Congress. And I'm happy to talk about what did we do at Bayer to fight the virus and combat this global pandemic. So my name is Monika Lesse, and I'm a Senior Vice President at Bayer. They're responsible for corporate R&D, social innovation, but also our societal engagement. I'm also heading the Bayer Foundation. And I'm very happy to talk to you today. And for the beginning, let me take you a few months back, end of January, when we were seeing the start of this whole pandemic. And when I think back, I remember pretty well when I was in close contact with our local head in China and trying to support them to fight the virus by providing PPE, providing medication, and also financial support to expand the healthcare system. But soon after, as you may remember, it became clear that this isn't a local, it actually is becoming a global pandemic. And so we were all sitting down on the leadership and thinking, what are actually our priorities in this situation? And of course, it was number one priority also to actually keep our production going so that we could still provide the medication to the patients in need. And I really have to say a big thank you to our colleagues in product supply who are going the extra mile. Then and now, every day, they have extra shifts, separate shifts. They commit themselves to social distancing so that we can produce the medication and deliver what we have promised to the patients. So that was a key priority for us and still is, of course. The second key priority is to keep our employees safe. And as you can see, I'm working from home office, as many of us do. Who doesn't have to be on the site is working from home to make sure that we all can again deliver what we promised to the patients. And finally, we were thinking all together, how can we as a company support across the globe the fight of this pandemic? And therefore, we decided to set up a global fund of more than 20 million euro in order to help our local organizations all across the world in this challenging situation. And so far, we have donated more than 20 million euro, 50% in financial support, meaning to help to build up healthcare systems and also especially protect healthcare workers as well as the patients. And also in providing our products. And here our whole self-care portfolio plays a key role, and also providing protective equipment. So from the very beginning, we focused our activities on the healthcare side to protect the patients, the healthcare workers, and also vulnerable patient groups. In order to drive our support, we have actually built our support on 5 main pillars, starting from raising awareness on the danger of the virus and on the spreading of the virus, to providing protective equipment and disinfectants, to mitigating the risk by providing tests and also helping healthcare workers, to treatment, and also in doing research. And I will give you now a few examples on what we did and are still continuing to do to really combat the virus. So talking about raising awareness, for example, we are collaborating with UNICEF in Brazil to support their activities in protecting the indigenous population in the Amazonas region. So that is very important because they are very much in the front and center and have no access to healthcare. So protection and support here is very, very much needed. We also, for example, are working with the London School of Hygiene and Tropical Medicine, and together with them have developed an SMS-based system to provide information to people living in rural areas in Africa, not only how they can protect themselves from COVID, but to encourage them still to protect themselves from malaria and get all the vaccinations they need. As you may just have heard in the recent report from the Bill and Melinda Gates Foundation, we see a rise again in measles and also in malaria because people don't take enough attention. So I think it's really, if we talk about protecting people and patients, it's really looking on a broader perspective, helping them to support, helping them to protect themselves from COVID, but also from other infectious diseases. Also early on, for example, we worked with Egypt on an awareness raising campaign and with many other countries to make sure that we prevent the spreading of the virus. So beyond this, we also transformed part of our production and produced more than 150,000 liters of hand sanitizer. As you may remember, soon after the pandemic hit, there was a real shortage of hand sanitizers. And our employees came up with the idea, can we not change part of our production and contribute to the current situation by producing hand sanitizer? And they really took the helm and made it happen so that we could provide it to the local hospitals and organizations in need with more than 150,000 liters that has been produced. Furthermore, we also transformed part of our research labs into a diagnostic COVID-19 test station. So we were approached by the local authorities as they didn't have enough capacity to do the COVID-19 tests. And as you know, it still is a shortage. And actually, we are still doing daily tests, and we are focusing on doing these tests for critical groups, which are also especially healthcare workers, but also police or the fire brigade. And you can see how proud our employees are that they can contribute in this challenging situation. Talking about self-care, we actually also provided more than 10 million products of our self-care portfolio. And I think Judy alluded to this, the importance of self-care in this pandemic. It is absolutely important to have access to these products. So we also helped and worked with organizations like Direct Relief, who then provided these products to vulnerable patient groups so that they can make sure that they can survive in a good way during this situation. In another example is, as also I think Judy mentioned pretty well, that people didn't go to the hospitals to get their treatment. And that's why we also helped to set up separate treatment sites or also delivered their medication directly to their homes so that they didn't have to come to the hospital and get the danger of getting infected. So I really have to say that our colleagues have been very creative across the globe to provide the best solution to the patients and also the healthcare providers. So overall, we have worked with an ecosystem of more than 80 global partners. So these are organizations like Direct Relief, the Bill and Melinda Gates Foundation, the Red Cross. And I'm truly convinced that we need collaboration. Otherwise, it will not be possible to fight the virus in this challenging situation. And we have impacted people on more than 60 countries across the globe. And just recently, as you have heard on the fire and the explosions in central Beirut, we have provided here more than 50,000 FFP2 masks to again stop the spreading of the virus. And also, just a few days ago, we helped to provide more than 25,000 medical masks to the refugees in Greece. As you know, the virus is spreading there quite heavily, and most of the people are really unprotected. So we keep continuing to provide our support, and I'm very much convinced it needs collaboration, it needs an openness in our minds to find new solution, and it also needs innovation so that we can overcome this situation and get out of it stronger than we have been before. Thanks a lot.
Okay, thanks very much, Monica. So if you unshare your screen so we can see everyone on the big screen. Thanks a lot. Ready. So we've had 2 talks now that have given us some really good leaders of where we can go forward. So Monica, that's great. Okay, so we can see everyone. Just to say that I put the links both to Judy and Monica in the chat box. So if you want to can look at what they're doing, you can look in the chat box and then you can get to their organizations and get the links. And we have just a few questions. I'm going to start with a question for Judy and ask you is the self-care movement, is it going to be applicable in all countries, for example, in lower income countries, or is it something that you need a certain amount of health literacy before you can go into self-care?
Yeah, thanks, Peter. Obviously, health literacy is important, and it's important on a whole lot of levels, just not just self-care. And of course, that's a major priority for us. But sure, we're seeing bigger self-care movements in more industrialized, higher income countries. That is without a doubt, and that's no surprise. But we're seeing it. We're seeing things change and turn around in countries like China, for example, Thailand, Latin America, and we're just embarking at the moment. We've set up a Africa self-care strategy group, and we're just looking at what we can do there at the moment, because while, for example, OTCs in terms of consumer health are widely available on the African continent, self-care is just nowhere. So there are no policies on the African continent in terms of self-care. So we're really looking at developing a strategy there to get it up and happening. But your premise is correct. It's more widely embraced, you might say, by policymakers, etc., in higher income countries. But still, there's a lot of work to be done.
Yeah, and I'm going to get a follow-up question just on the self-care while I've got you there. So I think Monica will think about this too, for both of you. As one of the other policies of the patient safety is to have antimicrobial stewardship and decrease the use of antibiotics. And often with self-care, maybe people will increase the use of antibiotics without having it. So is there a balance one has to get on these kind of messages we have? How do we educate people to self-care, particularly for minor infections which are viral, without using antibiotics?
Yeah. So first of all, I haven't seen any evidence. It's a good question. I haven't seen any evidence that people are using more antibiotics needlessly because they're embracing self-care. But you just bring home the point about better information, more information, better access to good information, and increasing health literacy for around the world, and especially, I think, in lower income countries.
Okay, that's great. Now, this is a question, I guess it's for you again, but I'm going to open it to Monica again. A couple of years ago, pharmacies in Sweden were privatized. Can I trust a pharmacist to change my drugs without a doctor involved?
Well, maybe I'll go first, then Monica can jump in. Yeah, look, I mean, many pharmacies around the world have been, there's private pharmacy chains around the world, and then there's community and etc. But I think a lot of pharmacies are private. around the world, and really there's no evidence that you can't trust that information just because the pharmacist is private or it's privatized. I mean, I think, as I said, this was a great opportunity as well for pharmacists, because I think pharmacists traditionally haven't got the kudos that they should have had over many years for the important work they do, but also the important resource that they are, and they just should be better utilized, and we saw it during the pandemic. But over to you, Monica.
Mm-hmm. Yeah, maybe I can just add, I'm coming from Germany, and many of our pharmacies are privatized. So it's for me the normal thing, and I would definitely trust a pharmacist because it's a very well-respected profession. And I'm totally with Judy that I think it's a resource undervalued. Many people don't need to go to the practitioner in order to get a medication. The pharmacist can do a lot. Yeah, so maybe we need more private rooms and special space and so on for consultation. But otherwise, I think the pharmacists, I mean, they have a very intense and a long study and a broad knowledge. So I really think we should more leverage the pharmacist. Yeah.
And I'm going to give the doctor's response to say that pharmacists understand drugs better than the doctors do, and the interactions of
interaction
and how they work.
Drug interaction.
And so actually it's safer to get it from the pharmacist in many ways. One last thing I'm going to say, because our time is up, and this was the Needham question, which I left at the end. It was a question from Vinald, who asked about the slogan towards zero harm, patient harm. And he says, couldn't the better have been stop harmful medicine now? Well, to tell you the truth, I discussed this with Needham on the slogan about people are going to ask you the question about towards zero. We'll never get there. How are we going to do that? And she says, well, look, what number would you want to put firstly? What percentage of harm would you accept? But the main thing is this is the aspiration. We know that this is where we need to go, and medication harm is part of that. So we also want to move to zero medication harm, but that's the aspiration we want to go, and we have to have very high aspirations in order to get even close to it. So that is why they're moving towards zero, because people often say it's a bad thing to have the word zero because you'll never get there, but really it is because that's the aspiration. But that is answering Needham's question, Chris. Pradeep, do you want to say something? You've been very quiet there.
Thank you very much. Peter did a great job. And thank you, Monica, and thank you, Judy. And I think after we have talked about safe self-care and healthcare, now let's look at safe medication and how patients can engage in manufacture of that. I think simple things as how are those labels put on and how are those patient information leaflets prepared. So I would now ask the audience to join us back in the auditorium and start on the next session of UPATI. This is a European Patients Academy that has trained up lots of UPATI fellows, really knowledgeable expert patients who have gone on and really influenced research, clinical research that is patient-centric. And I think they can help us a lot in safe medication development on this World Patient Safety Day. So thank you very much, and I'll see you on the other side. Thank you.
Thanks very much, everyone.
Thanks, everyone. Thanks, Carla.
Bye-bye. Bye-bye.
Bye. Thanks, Peter. Thanks, Monica.
Bye.
Bye-bye, Judy,
Bye.
Peter.
Bye.
Bye.
Thank you.